All right, so today I'm just here advocating on behalf of students. I'm a school counselor in the school district, Mesa County School District 51. And so I'm here advocating for students that have mental health issues, and then also as an advocate for professionals that serve them. So as a school counselor, I just wanted to talk a little bit about my experiences in working with the mental health system here in Mesa County. So as professional, I've worked with Colorado West, which is now Mind Springs, and then I've worked in the community counseling field with CEC, the Counseling and Education Center, and then I've worked now with the school district for 12 years. So have experience in all realms, and then prior to that I worked at the ATU, the Alternative Treatment Unit, before it became part of Colorado West and then became non-existent. So lots of experience in the community. So right now, the reason I'm here talking today is to address concerns that I have with the current system as it stands with Mesa County in the mental health field. So oftentimes as a school counselor, I get kids that are suicidal, and so I have to work with the current system, which is Mind Springs. The biggest concern I have and why I wanted to be here today is about the crisis response team and how that's being held. The way I understand it is over the phone, and we have huge concerns about that. We have had kids that are struggling at our school. We go through a process to do suicide risk assessments, surveys, and after we determine that they are suicidal and have a plan, then we need to make a referral to the mental health facility. When we do that, now it's not calling the facility, but we're calling a phone number, and then they're having to do an assessment over the phone. That's a concern that I have as a mental health professional, that's being done over the phone. It's not the best fit for our kids. So that's a big change that's happened. I understand it has to do with funding maybe, or a contract being lost. However that happened, that's a concern. Then when kids are being brought to the Mind Springs facility, they're having to wait hours. We've heard up to 9 hours to be seen, and that's a concern, especially when we have kids in crisis. What's working? I guess I want to be able to share what's working, what's not. We have heard that Mind Springs is providing group counseling. We have kids that have had success doing that, and so that's definitely a strength. We're glad that we have Mind Springs, where our rural people do not, so we're happy to have that resource. And we do have psychiatrists and psychologists that kids that can be seen. Although there is wait lists, they are able to be seen, and so that's been a positive thing. So I've expressed concerns about school counseling and working with mental health, and then I've expressed concerns about the service they receive when they get there. And then of course the positives, but as a professional, I also have concerns as we're burning out people in our community. And this is actually something that I feel professionally as in representing my peers. But accessing counseling for adults, especially when you're a professional, is hard. And then you add in insurances, which our families feel, I know, and then I feel as a professional. I work for the school district. We're the biggest employer in the town, and we have 2 counselors that are covered by insurance. So if that doesn't say something, yeah, I can go to whatever council I want to, and we have lots of counselors in our area, but that's going to be covered by insurance. There's 2. So that's a problem. So that's just kind of just coming around. So to what's happening for me is that through all the dealings with the mental health issues with our students, that I feel taxed. And so I did seek the help of a class that we're taking. It's a resiliency class. I'm the only mental health professional, as far as I know, in that class. There's a lot of professionals throughout the community, whether it's Department of Human Services, medical field, but I'm the only counselor that was in the room. And when I asked about other counselors, why aren't you there? They said that they don't have enough time for that. So that's concerning that we're not providing an opportunity for people in the mental health field to get support. Let's see. So some suggestions I had just moving forward with the behavioral health team or task force is I'd really like to see an evaluation done on the intake that's happening through Mesa County and Mine Springs, and that to be looked at with real time and what's happening with families and students. I'd like to see more mental health support for the people that are providing the services, the mental health services. I understand at Mine Springs there's a lot of turnover, people that are being hired that aren't necessarily trained to do the work that they're doing because there's not enough people that are sticking around. And then providing more funding to the school districts. Right now we have in the school district, we have mental health professionals 2 days a week that come into our school, which is great. It's more than we had before. However, this person is now serving 3 schools, and so we need more of that. It has been a help right now because of the limited time we have that person. They're just putting fires out. They're not really doing preventative work, which is what we would like to see happen. So if there's any state funds or any access that you guys have, I know it's always about funding, but if there's any funding that can be provided to the schools more than is already being provided, which the way I understand it now, the funding that we're getting for mental health isn't from the state, it's from Medicaid. I guess that's federal dollars, right? So it would be nice to have the support for mental health, to have more pro-social and mental health activities through our schools. We are involved with the Sources of Strength program this year, and that's been super helpful as a school in changing culture, but it doesn't address the individual needs of kids that we need to continue working with. So tried to cover a lot in a short amount of time. I also did, before I came here, I wanted a lived experience with a family that has gone through this consistently. So I made a phone call to a family of a student that has been in and out of Mine Springs probably 12 times in the last 6 months. When I asked her, you know, how that experience was, she jumped all over that. Was just like the agencies that serve her child do not communicate. Outpatient, I'm talking Mine Springs, outpatient, inpatient. That's the same facility, and yet they don't communicate. The psychiatrist was out of town for 2 weeks. They needed a med change immediately. They had to get an adult psychiatrist to see her son. They prescribed an adult medication. There was some tracking that needed to happen because of that. Then when the new doctor came back, they didn't communicate that that had happened. So that's a pretty big deal. That's continuity of care, you know, that wasn't happening. She has figured out the system well enough that she knows to call the hospital. She doesn't go through intake. She just calls the hospital and they are ready for him when he gets there. So that's nice. The things that are working are Medicaid. They call and check in up on them. I was just shocked to hear that. That's pretty amazing. The primary care doctor works well with them, and that she's figured out the system. When she goes in for outpatient counseling for him, she has yet to have a one-on-one. This is a kid that's been in and out of the hospital 12 times in the last 6 months. She has yet to get in to see a counselor through Mine Springs because they're so backed up. They're supposed to go in at a certain time from 2 to 5. Apparently they wait, and if they're lucky, they get seen. That's how I understand it. So she went in last time, they finally got in to see the counselor, and he said, I'm sorry, this is a 15-minute session because this is just to get to know your kid. In 15 minutes? It's pretty...
Gwen, you have about 30 seconds
Okay,
left.
so it's pretty concerning. Those are just the concerns that this mom shared with me. Kind of confirms, that we got to figure out this system and continuity of care. So thank you for that time and listening, and hopefully I was helpful.